Okay, hello. This is chapter 10, the muscular system. We are going to endeavor to cover all of the muscles in one chapter. I've distilled it down to 27 or so slides. It's a lot of information, a lot of muscles. Each muscle has a story to tell, which we're really not going to have time to go into, but let's go through the different muscles. Okay, firstly, there are arrangements of the fascicles. Circular is one type of muscle, like orbicularis oris, around the mouth. Then there are convergent muscles, where the muscle groups converge onto a single tendon, like pectoralis major. There are fusiform muscles, where you have two muscle groups that have fused into one belly, like biceps brachii. They're parallel, where the fibers are parallel to each other, like sartorius. Multipenne would be multiple bellies per tendon. This is like the deltoid. Bipenne would be two bellies per tendon, like rectus femoris. Or unipenne, where you have is one belly per tendon, like extensor digitorum longus. Okay, so the muscles take advantage of load in order to produce a certain effect. And if you look at levers, we've got the load, the effort, and a fulcrum. Fulcrum is going to be your midpoint, and the fulcrum changes location, which changes the load and the effort. So if you want to have a power stroke or a very powerful contraction, the fulcrum will be as close to the load as possible. For speed, the fulcrum is away from the load, and this produces the greatest speed, but there's a mechanical disadvantage where there's not a lot of power. So changing the fulcrum changes the mechanical advantage. Okay, so there are three classes of levers in the body. Let's just go through these. So the first class lever, the great example is raising your head off of your chest. So we've got load and the effort, with the fulcrum right in the middle. And so it's the arrangement of elements. There's a fulcrum, a load, fulcrum, effort, depending on the fulcrum location. So this is nodding your head, will be a first class lever. Second class lever is like when you're standing on your tiptoes. The effort is exerted by the calf muscles pulling the heel upward. So the ball of the foot will be the fulcrum, and the effort would be one of the muscles like the gastrocnemius. So second class levers, the fulcrum is away from the load. And then third class levers is like flexing the forearm. The fulcrum is the elbow joint, and the load is the hand or the distal end of the forearm, and the effort would be the biceps. So there's a mechanical disadvantage to this third class, but there is a speed advantage. Okay, so there is a way of learning this, a mnemonic. So you got first class, second class, and third class levers. And if you memorize FLE, it can help you determine where the lever is. So the first class lever, the fulcrum, is in the middle. So that's your F. So first class lever, the fulcrum is in the middle. This is like nodding your head. The second class lever, the load, or the L, is in the middle, like standing on your tippy toes. And third class lever, the effort, is in the middle. And so FLE, fulcrum in the middle, for nodding your head, first class. Second class, the load is in the middle, as in standing on your tippy toes. And third class lever, the effort, is in the middle, as in curling or using your biceps. FLE, fulcrum, load, effort. First, second, and third class levers. Okay, so let's go into the muscles. I'm going to identify the major muscles, but we've got the frontalis, which is part of the epicranius, which includes the muscle belly, as well as this epicranial aponeurosis. There's also an occipital belly. So this frontalis muscle is quite long. In the middle, there's aponeurosis. Above, or right adjacent to the temporal lobe, is the temporalis. You can feel this guy when you're chewing. And then around the eyes is orbicularis oculi, a circular muscle. There's a muscle called levator labii superioris, which elevates the lip. There is zygomaticus minor and major, which is attached to the zygomatic process. A number of muscles in your cheek, like the buccinator. This is the bugling muscle, the muscle you use when you use a wind instrument like bugle. There's the risorius, which leads to like smiling. The masseter, this is a chewing muscle. Mentalis, this when you can furrow your chin, and your mentalis will contract. The depressor labii inferioris will pull the lip down. Depressor anguli oris will pull the angle of the lip down, like frowning. Platysma is this flat sheet of muscle through the neck. And a little deeper to platysmus, we have the sternocleidomastoid. And then in through the neck is the trapezius, which we'll get to. So these muscles, when you contract them, there are various effects. So zygomaticus major is a good one for smiling. Orbicularis oris for puckering. Mentalis for pouting. And platysma, this girl is contracting her platysma. Corrugator supercilii, I didn't do that one, but angry eyebrows. Orbicularis oculi, would be to close the eyes. And the frontal belly of the frontalis is what allows the eyebrows to raise. Okay. So here's just another look at the orbicularis oris, the buccinator, the masseter, and the temporalis. Deep to the masseter, there are the lateral and the medial pterygoids. The tongue is held by the genioglossus, the styloglossus, and the hyoglossus. Looking at the neck, a good landmark is the sternocleidomastoid. So, sternocleidomastoid. It tells you about the insertions and origins of this bone. You also have the sternohyoid, the thyrohyoid, the stylohyoid, as well as the digastric, which has a couple of different bellies, has an anterior and a posterior belly. These are muscles of the neck. Taking a lateral view, there are pharyngeal constrictors. There's a superior pharyngeal constrictor, a middle, and an inferior pharyngeal constrictor. Here we've got our sternocleidomastoid again, and deep to that we've got our scalenes, the middle, anterior, and posterior scalenes. These scalenes are going to participate in forced inspiration. You can see they're attached onto the ribs. If an individual is struggling to breathe, you might see some contractions in the neck, and this would be the scalene muscles trying to compensate by lifting that rib cage up to get inspiration. Other muscles of inspiration are the external intercostals and the internal intercostals. Now, the internal intercostals are for forced expiration, where the external intercostals are for inspiration. At rest, however, the major muscle of respiration is the diaphragm. And here you can see this flat sheet across the abdomen. Okay, we get to the belly. There are four muscles that make up the abdomen. There's the rectus abdominis, which rectus means straight, and so this muscle is very straight. Then there's the transverse abdominis, which comes at a 90-degree angle to the rectus abdominis. It's deep to the rectus abdominis. There are two different obliques. There is an external oblique and an internal oblique. So the four muscles of the abdomen are the rectus abdominis, the transversus abdominis, the internal oblique, and the external oblique. Here's another look at the abdominal wall with the external oblique, the rectus abdominis, and the internal oblique, as well as the transverse abdominis. Okay, if we look at the pectoral region, we can start with the sternocleidomastoid. We've got the deltoid, pectoralis major, biceps brachii. Deep to that, we've got the subclavius, pectoralis minor, and the serratus anterior. Here's another look. We've got the sternocleidomastoid, the deltoid, pectoralis major, and the arm, which we'll look at in just a minute. We've got the biceps brachii. Anterior and posterior would be the triceps brachii, as well as the brachialis and the brachioradialis. One more would be the coracobrachialis. Okay, looking at the back, this large V-shaped muscle is the trapezius. It goes from the neck all the way to the mid-back. The latissimus dorsi, these are also called the lats, goes under the armpit, very large sheet. Okay, deep to the trapezius is the rhomboid minor, the rhomboid major, and the levator scapulae, which pulls the scapula up. There are different rotator cuff muscles, the supraspinatus, the infraspinatus, teres major, and teres minor. These are what's going to stabilize this glenohumeral joint. Here's the humerus. This is a posterior view showing the triceps with its 3 heads to it. You can see the latissimus dorsi. And then there's a small muscle called the anconeus, which spans the elbow. Here's another look at the biceps brachii with its short and its long head. And then deep to that, the coracobrachialis and the brachialis, as well as the subscapularis. Okay, looking at the forearm, we can start with the biceps brachii, the brachioradialis, very large body. Underneath that, pronator teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris, flexor digitorum superficialis, flexor pollicis longus, and pronator quadratus. These are all muscles of the forearm. Okay, we take a look at the pronated hand. We've got our extensor pollicis longus, extensor pollicis brevis, abductor pollicis longus, extensor digitorum, extensor carpi radialis brevis, extensor carpi radialis longus, anconeus, extensor carpi ulnaris, and the extensor indicis. Now with these muscles, you can take apart the name and indicate its function. So if we go deep, we've got the anconeus, supinator, abductor pollicis longus, extensor pollicis longus, extensor pollicis brevis, and the extensor indices. See another view of these, as well as the interossei, separating the metacarpals. Okay. So we look at the superficial layer of the palm. We've got opponens pollicis, abductor pollicis brevis, flexor pollicis brevis, adductor pollicis, as well as lumbricals and interossei. On the other side, we've got flexor digiti minimi brevis, abductor digiti minimi, and opponens digiti minimi. You can imagine the motion of the fingers with opponens digiti minimi. looking at the palmar surface, the second layer, we've got the palmar interossei, opponens digiti minimi, opponens pollicus, abductor pollicus brevis, flexor pollicus brevis, adductor pollicus, and dorsal interossei. And this last figure showing the deep palmar interossei and the dorsal interossei. And looking at the palmar surface and the dorsal surface of the hand. Okay, let's move down to the hip. The pectineus is cut away here to show the adductor brevis and the adductor longus, as well as the adductor magnus. Around the femur is the vastus lateralis, the vastus intermedius, and the vastus medialis. The rectus femoris, probably the largest muscle of the thigh, is cut away here. And so here we can see the medial gracilis, adductor magnus, adductor longus, pectineus. What separates the compartments is the sartorius, is another landmark muscle. I always look for the sartorius. We've got the quadriceps, vastus lateralis, and vastus medialis. If we go cranial a little bit, we've got the iliopsoas, the psoas major, and the iliacus. Looking at the lower leg, well, first the posterior buttocks, you've got the gluteus medius. This is where a lot of injections go. The gluteus maximus, which is the buttocks. Then the hamstrings are made up of the semimembranous, semitendinous, and biceps femoris, long head and the short head. An anterior view of the lower leg shows this tibialis anterior, extensor digitorum longus, extensor hallucis longus, and fibularis tertius. So another view anterior shows this tibialis anterior, the extensor hallucis longus, and the extensor digitorum longus. A lateral view shows the fibularis longus and the fibularis brevis. We can see the posterior gastrocnemius. Under the gastrocnemius is the posterior soleus. Here we can also see the tibialis anterior in the anterior compartment. And in between, the extensor digitorum longus, fibularis longus, and fibularis brevis. Okay, so usually we would just see the gastrocnemius here. We've cut that away. Then we would see the soleus. We've cut that away. And so underneath, there is the popliteus in the popliteal space. Tibialis posterior, which is opposite of tibialis anterior. Flexor digitorum longus, flexor hallucis longus, and flexaris brevis. These are going to be deep to the soleus and the gastrocnemius. Anteriorly, we've got the, still posteriorly, we've got the tibialis posterior. Okay, looking at the foot, there's an abductor hallucis, flexor digitorum brevis, abductor digiti minimi, deep to that, this is still the plantar view. We've got lumbricals, a number of lumbricals. And deep to that, adductor hallucis, flexor hallucis brevis, flexor digiti minimi brevis. And then the most deep plantar aspect would be the plantar interossei. And then you flip, you've got your dorsal interossei. Okay, that was a lot. And each muscle has a story. The best way to do this is to first read the questions and then work on your memorization. And so what we'll do in the class is to go over this again, but really focus on the questions so you can learn landmark muscles and go from there. All right, I'll see you in class.